In my little niche of medicine, there's so much off-label use of medications to grow hair and compounded medications to grow hair. Examples include metformin, oral minoxidil, which I take, cimetidine, spironolactone, and topical finasteride, which has been used by some other large companies kind of indiscriminately. And the FDA recently made a few points about the off-label use of topical finasteride, and rightly so, because some of the way these companies have been prescribing it is suboptimal. No cautions for patients, as if the compounded or topical versions have no risks. Some companies even hide the list of possible side effects or don't include it at all, or you don't get to talk to a doctor, which also makes it difficult, incidentally, for patients to complete adverse events reporting if they're using like a compounded medication. And that means that patients and their doctors can't make informed decisions because we don't have a complete set of data. So, everything the FDA pointed out is welcome news from where I sit. For the record, we definitely prescribe medications for our patients off label for hair growth, which is perfectly legal and is very common. Because those patients for whom we as doctors believe they'll be better served by a compounded or an off label use, like using something topically when it's usually taken orally, we are allowed to do that. And if you can't tolerate or take an oral medication, a topical is perfectly reasonable and will get you some hair growth. So, if you can tolerate and take an oral medication like finasteride for hair, great. And 90% of my patients have no problems whatsoever. We don't even need to adjust the dosing. If you cannot tolerate it and you need another option, compounded medications are another choice. There's a time and a place. Like I mentioned when I was talking about the Wall Street Journal article, there's a time and a place for all of this, and doctors need to be involved. So if you need a topical medication version of finasteride, you and I are going to discuss Zion with you, which Zion, incidentally, is a good player in this space. They have their own adverse events reporting. They only work with physicians who work with hair patients, and they distribute their adverse event information and their reporting data with each bottle and on their website. It's really obvious. And if you need oral minoxidil because the topical gives you a rash, or you can't remember to take it, or twice a day just doesn't work for you, or you're a swimmer and it always rinses off, we're going to talk about the pros and cons for oral minoxidil. So there's a place for compounded medicines, and there's a place for off-label use of these different medications. And let us explain if they're right for your situation. Involve your doctor. And we are thrilled that the FDA chose to point that out.